Now it is my pleasure to introduce His Excellency Martin Roper, Governor of the Cayman Islands, to provide some opening remarks. Your Excellency.
Good morning, everyone. I'm very pleased to welcome you all to the 4th Annual Youth Mental Health Symposium. And I'm pleased to say this is the 3rd occasion I've been able to make some welcome remarks, which means I've now been here. I'm now well into my 3rd year in Cayman, and it really is a huge privilege for me. I think I had more hair when I first arrived, but every cloud has a silver lining because I now have a few more grey hairs as well. I'm pleased to be here to welcome you all. And of course, last time when we did meet, as we've heard, February 2020, we were gathered here and none of us had any idea of what was about to confront us. And as we've heard as well already, it is really heartening that we are able to gather here this year for the symposium, something that is not possible in most places around the world at the present time. And I join what's already been said. I think we should all be very grateful that we have this opportunity, but it really is thanks to all of you in the community, because it's the community which has got us into this very favourable position. We still have a long way to go, and I encourage everyone to continue to play their part. And in particular, I encourage everybody to take advantage of the vaccine when invited to do so. This really is our way out of this global pandemic, increasingly evident that vaccines are safe, and we really do want you to protect yourself and our elderly and vulnerable in our community. 2020 was, of course, challenging for all of us, but especially so for our young people. And my office has been acutely aware of the strain that the lockdown and the continuing impact of the pandemic has had on the mental wellness of Cayman's youth community. Remote learning, separation from friends and family, loss of family income, missing milestone life events such as graduations, fear of the unknown, obsessive social media usage, the impact of undefined external exams, inability to take part in sports and other extracurricular activities, and uncertainty around travel and college placements. All these things and more have had a significant negative impact on youth mental wellness, triggering mental health concerns and exacerbating existing ones. A recent poll for The Observer suggests that in the UK, by the end of 2020, as many as 10 million people, including 1.5 million children, were thought to be in need of new or additional mental health support as a direct result of the crisis. And the UK is facing the biggest hit to mental health since the Second World War, with lasting effects. Isolation, anxiety, and uncertainty over the future have destabilized an entire generation. COVID-19 has obliterated support systems and coping mechanisms, and those that have experienced childhood and adolescent trauma are particularly vulnerable. In the United States, one study found that 70% of young people aged 13 to 19 are struggling with their mental health in the wake of COVID-19. And a recent UNICEF study covering adolescents and young people from 13 to 29 in 9 countries in Latin America and the Caribbean found that 73% of young people felt the need to ask for help concerning their physical and mental well-being. And it's concerning that despite this, some 40% did not reach out for the help they needed. We are therefore fortunate that in Cayman we have an organisation such as the Alex Panton Foundation to champion our young people, raise awareness of their challenges in this unusual time, and provide real support when needed. And I was so pleased to see the Foundation jump into action with innovative ideas on how to assist those most in need during lockdown, such as online forums, social media campaigns, and peer support groups. I particularly commend the public and private sector volunteers who launched the mental health hotline, providing this vital resource at the beginning of the pandemic. I was also very happy to see such a high level of collaboration during and after lockdown with the Foundation working with other entities such as the Red Cross and the Crisis Centre, as collaboration and coordination is the key to making a real difference, creating synergies as opposed to duplicating efforts. And we're going to hear a lot more about that today. Of course, the long-term effect of the pandemic on youth mental wellness is still an unknown. So it is really encouraging to see the Alex Panton Foundation places such high importance on the gathering of data to better inform our decision-making moving forward. Continuing this evidence-based approach will be crucial to learning more about the real and ongoing impact of the pandemic and how, as a community, we must allocate time and resources to counter these effects, likely for years to come. So the theme for this year's symposium, Reflection, Recovery and Resilience, it's right that we pause to reflect on the unique challenges of the past year and that we highlight important and ongoing recovery efforts, but we must also focus on the future and on building resilience. And building resilience in our community of young people, starting at an early age, to better equip them with the tools they need to deal with the challenges that will come their way, whether at a global, national, family or individual level. The Alex Panton Foundation, in partnership with the UK-based non-profit organisation Partnership for Children, helps to build resilience in children ages 5 to 9 through its emotional literacy programme. And I was impressed to learn about this initiative at last year's symposium and delighted to learn that the programme is now being run in 14 government schools in Grand Cayman, Little Cayman and Cayman Brac. Hadn't quite finished, including the Lighthouse School, as well as 8 private schools and NGOs. This last year has highlighted even more the importance of such programmes, and we will hear an update on that later today. And I encourage everyone to visit the information booths outside to learn more about these and other programmes, including the excellent Youth Ambassadors programme. The Alex Panton Foundation has become an invaluable resource in our community in only 4 short years. And I do want to pay a special tribute to Jane and Wayne, the Foundation's board and staff, and the many volunteers for all their hard work in making a real difference. And I think we all recognise the courage and bravery of Jane and Wayne, and particularly Jane standing up here and speaking in the way that you did this morning, and we really do appreciate that. I want to just end with 2 very brief personal reflections about the pandemic. I think the first one is really about kindness. I think it's increasingly clear that all of us need to show more kindness, whether it's at home, whether it's in our workplace, whether it's in the community, particularly on social media. If all of us make a greater effort to show kindness to each and every other person that we come across, that in itself will have a small impact on some of the mental health challenges that we face. I also very strongly believe that COVID pandemic will be a game changer in the views we take of people who provide services in our community, people helping other people's lives. So the status and respect we give to our healthcare workers, to our care workers, to people on the front line in law enforcement, to people in supermarkets, to people delivering goods to people's homes. I really believe that society as a whole has to give more status and recognition to people in those occupations. And I think that will be one of the major changes coming out of this pandemic, and I believe that will be very welcome, and it's very, very necessary for our youth as well. So let me just end by saying that I do believe mental health is one of the enormous challenges of our age, and in Cayman, as everywhere across the world, all of us need to recognize we need a major step change in what we do to help everybody with their mental health in the years and probably decades to come. Thank you very much.